welcome everyone, and very good afternoon to all of you. Today we have Dr. Adhikary with us, and he's going to enlighten us on allied sciences as a future prospect. So today we'll have a discussion on that, and he'll be giving us some important points and important tips with what we can choose for our future career and what we can pursue. So welcome, sir, and over to you now.
Good afternoon, all. Namaskar. I'm Jit Adhikary. I am the consultant and faculty in Amrita Hospital, Faridabad campus. So, first of all, you can see in the screen, it's Amrita Vishwa Vidyapeetham is our university, which is basically university is in Coimbatore, and we are having all our campuses all over the India as well as in abroad also. So it's a huge campus and network. We are having lots of our branches, our school and colleges. So presently in Faridabad campus, I am the consultant in Faridabad campus. So I will talk about today. We'll discuss about Faridabad campus only. So it's we are having total campus area is 130 acres land, and we are having medical college along with corporate hospital, which is 2,600 bedded hospital with latest infrastructure and world-class facilities. And in today's date is the Asia's largest hospital. And presently we are offering MBBS program. Then we have nursing college, we have allied health colleges. So we are running all the undergraduate program. We have started from last year only. Already our first batch is running. Now this year we are going to take, and already we are absorbing the this year batches. So this is all about our university and the hospital. Next. Yeah, this is me, Jit Adhikary. As I told you, the consultant faculty. I'm the instructor of ACLS BLS program, and I'm the general secretary of IFPI. Thank you. So first, I will talk about the admission process of allied health science. We generally, we are conducting every entrance exam for allied health science. The criteria is 65% in total class 2. And along with your subject should be physics, chemistry, biology. In some specialty, math is mandatory. So all the subjects, at least you have to score 55%. Then only you will be eligible to sit for the entrance exam. On basis of the exam marks, we are providing the admission. In some cases, suppose a few seats are vacant, then we can offer, or we are offering, some direct admission that is optional. Okay, next. See, the selection process, again, I explained already, the physics, chemistry, biology, and English mandatory. Now, age group, next. Age group is minimum 17 years, and this thing maximum for the basis of that year, 31st of December. And the link is already given. You can see the website link. So you can go to that link and you can apply from there, and you will get all the details from there. Next. Okay, so as I told you, presently we are offering 17 courses in allied health program. So the courses are operation theater technology, then your dialysis technology, then emergency medical technology, cardiac perfusion, then cardiovascular, then respiratory therapy, echocardiography, medical laboratory technology, then neuroelectrophysiology, radiology technology, then intensive care technology, anesthesia, nutrition, blood bank, physiotherapy, medical radio imaging technology, Bachelor of Physician Associate, Bachelor of Optometry. Next. So these are the courses we are offering presently in Faridabad campus. Along with that, we are also offering masters in hospital administration. That is also we are offering along with nursing and MBBS. I will. You are just. I mean, I can understand you have lots of questions. I will come on that. First, let me go through for the entire session. Then I will come to your question answer session. Okay. So first, I will discuss about Operation Theatre Technology. It's a. I mean, see, all the allied health courses in present day. Trust me, it is a very promising profession in today's date. Basically all the allied, what is allied health profession? It is basically a bridge between a doctors and nurses and a doctor to a patient. So see, in the medical field it is all about a teamwork. Without the helping hand, without the other profession like nurses, like all the allied health professional, without them a doctor alone cannot treat a patient. I mean, see, doctor job is to assess the patient, have the diagnosis, then advice for the treatment. But execution, that execution part should be done, or and as a teamwork to treat a patient, to manage a patient. Every doctor needs helping hand. So these are the hands for doctors, like nurses, like allies. So it's a very promising profession in today's date. Not only in India, in abroad also, it is a very well-known profession, and all the categories, all the specialty are equally important and equally can give you a bright future and a promising future financially and in other way also. So first, if I talk about the operation theater technology, first we have to understand what is the operation theater technology. In operation, suppose one patient is going for any operation, any surgery, any procedure. So surgeon has to operate that patient. But before coming to operation, there are so many things that you need to maintain or need to, need to prepare, like your OT, from starting from the OT table, your machine, equipments, then patient position, patient proper, preparation. This has to be done by the team, and that team, a part of that team is the operation theater technology. They are responsible to maintain or monitor all the equipments of the OT. They are responsible to give a proper position for every operation needs some specific position of the patient to expose that area. Like if I give example, for cardiac surgery there will be specific position, for other surgeries like for general surgeries there will be other position. So every operation needs some special position for a patient. So that position, everything should maintain or done by the OT technicians. Then all the equipments to maintain that, to sterilize that, to make that things ready, to make that machines disinfected, all are depends on this OT technicians. So this is very promising and very challenging job as well as. And once you are done this course, if I talk about the what next, once suppose you have done a BSc in OT technology, then what is next? You can offer or you can be go through. So there will be two options. Either if you want to do job, obviously with the BSc degree from any, not only Amrita, any good UGC recognized valid university, if you do your BSc program, so jobs are there. I mean, you will be offered to get job in all the corporate hospitals, private hospitals, then diagnostic centers, nursing homes, and in government sectors also. So jobs are there. I mean, demand is very high, but the professional, skillful persons are very less in today's date, in all over India as well as in abroad. So in that way, future will be bright if you want to continue as a profession. And if you go for higher studies, you can get option to do masters, you can go for PhD, you can go to research, or you can switch to any administrative this thing course further from this BSc program. Okay, next. So as I said, this masters and everything there. Next is dialysis therapy. Again, it is also a very important profile. dialysis patients, like all the nephro department, they are having dialysis patient. Those who are waiting for the transplant, kidney transplant, or they are having routine dialysis. They has to go for dialysis. Some patients are going thrice a day for dialysis. Some patients are going alternative day. Some patient is going one day in a week. In that way, they have to go for dialysis. They are coming for the dialysis. They're doing 1 hour, 2 hour, 3 hours of dialysis, and then going home. Or if in hospital patient, some patient is admitted for kidney failure, they has to have the dialysis. So this dialysis doctor, I mean nephrologists are advising for their dialysis, all the therapies and how to do it, what will be the duration, and what will be the logistics. That advice should come from a nephrologist. Then what about next? Then the job depends on the dialysis technicians. They are seeing that advice and they are following and executing to the patient. In ground level, dialysis technicians are taking care of that patient to maintain that advice, to execute that advice. That is the job profile. Again, it is also a very good profession in today's day. You can find n number of dialysis center in everywhere. Small centers are there, dialysis center. All the big hospital, corporate hospital is having dialysis unit. In government sector there is a dialysis unit. So it is there everywhere. So demand is also very high. Manpower requirement is very high. Again, there is also a mismatch between the demand and the good, knowledgeable and skillful person really available. So that's why job opportunities or profile is very good, very promising. You can have a very stabilized, good future in this profession, and as well as you can earn monies also, a decent amount of salary. And again, if I talk about the next future prospect, here also you can get option to do your further higher studies, and you can go for the masters as well as PhD, and you can switch to any administrative course also in future for higher studies. Next. So this is what I said. Next is Bachelor of Physician Assistant or Associate. Previously, it was a physician assistant. It now, after this Allied Health Bill 2020, the terminology has been changed. It became a physician associate. Well, this physician associate program is a very unique and very promising profile in today's date. First, let us understood what is this profession is. So a physician associate basically a bridge between a physician and a patient, or a physician and a nursing department. So physician associate, now the next question is, where is this physician associates can work? So the answer will be wherever a physician is working, a doctor is working, there can be a physician associate in every specialty, in every department. In today's date, physician associates are working in OPDs for the entire hospital. They are working starting from the OPD, in hospital ward, emergency department, ICUs, OTs, everywhere they are working. What is the job profile? So job profile is physician associate basically are hands of the physician. I mean, they can first screen the patient, they can assess the patient, then they can uh, note down all the summaries for the OPD. Then that patient will go to a physician, and the physician will go through all the assessment and put his or her advice. In OT, they will be the person who will assist to a surgeon for the OTs. Then in ICU, our physician associate are screening a patient, treating a patient. In some extent, they are doing the diagnosis. So everything in terms of patient care, they are working in everywhere. So only the I mean contraindication part is, I mean only the negative part is, physician associate till now, as per the medical law, they are not entitled to do their own private practice. Wherever they want to work, they have to work under a supervision of a physician. That is the thing. So they can do everything. They can be a part of diagnosis. They can assess a patient. They can treat a patient, but under supervision of a physician. So area of work, I already told you. Now, if I talk about the future prospect, So future prospect is very bright. After completing BSc is the first generalized degree. After completing your BSc, during your internship, you will be entitled or you will be allowed to choose your specialty according to your interest. So BSc will be the general degree. During BSc, you have to go through all the specialty. After BSc, after your 3 years of course, for the internship, you can choose your specialty. Suppose one person is interested in nephrology, that person can do specialization in nephrology. Somebody is in general medicine, can entitled to do specialization in general medicine, cardiology, anywhere. So any specialty, they can do their specialty. Next slide, please. So, if I talk about the future prospect for higher study scope will be a master's in physician associate. Then there will be backslide, please. Then there will be PhD program. Then they can pursue. They can entitle for public health masters. They can go for any other management degrees also. They can or else somewhere they can work as a research team, or they can do their specialization in research. And few institute and the medical college, they can work like a tutor or faculty also. Next. Now, bachelor in optometry. Again, it is also a very well-known profession in today's days. So, what is optometry? Optometry means in any eye related disease or problem, first you have to go to any eye department. So, first person who will screen your eye, that is an optometrist. So that person with the machine and gadgets, they will assess your eye. They will note down all the, suppose you are having powers, so they will note down all the powers. If you are having any problem in retina or any cornea related disease, so that assessment or that diagnosis, that provisional diagnosis will be done by a optometrist. Then with that diagnosis, that paper, that evaluation, that patient will go to a eye surgeon or an eye doctor. Then according to that diagnosis, the doctor will advise what need to be done in further. Suppose it will be cured with the medicines, they will advise for the medicines. Suppose it needs to go through for any intervention, any procedure, so any laser therapy or anything, that advice should come on basis of that. So this, why I told you this thing, because to understand, to make you understand what is the sincerity, what is the responsibility, or what is the seriousness of this job profile. I mean, it is equally applicable for all the thing, all the other specialties also in a similar way. But optometry, the first screening. So if this ground level person, allied health profession, if they will do any mistake or they will fail to assess that diagnosis properly, the entire treatment will be wrong. So that's why they are the, I mean, why I'm telling you this, because this is the first level of screening which is done by this allied health professional, which is very very important and very very promising and very very serious for in patient care. Now if I come over the optometrist, so this is the job profile they have to do. If I talk about in future, what next after degree, so after BSc, they are eligible to work in any private corporate hospital where the eye department is there. They can work in any diagnostic center. They can work in any nursing home or small hospitals, or in a government hospital also. Along with that, there will be opportunity for optometrists. They can work. Now there's multiple shops and centers are there for lens and specs. So there will be one opportunity for them. Suppose daytime they are working in any hospital or associated in any hospital. Then in the evening time they can open their own shop, or they can do their own practice in any lens or spec shops. So they can be associated with many multiple in that way, and they can earn more monies in that way. So this is about their professional this thing future. If I talk about the next opportunity for your higher studies, obviously there is also option for masters and PhDs also. Next. So next is emergency medical technology. So every hospital, whether it is a big hospital or a very small nursing homes, there will be emergency. There will be emergency department. So these emergency medical technologies are specially trained to treat the medical emergencies for any patient. They will work to take care of I will come to, there was a question, I will come to you. Don't worry. So, see, in emergency, medical technology, the person have to work in emergency department. So suppose one patient coming with any emergency. So the first initial assessment, initial thing or acute first aid should be done by these emergency technologies and along with the team of that rescue emergency team. There will be doctor, there will be nursing staff, and along with them there will be allied health professional. There will be emergency medical technologies. In somewhere medical emergency technologies are working in ambulance service also. They are entitled to go with the ambulance to take care of the patient during the transportation of emergency situation or emergency sick or ill patients to the medical facilities. So suppose on the way there's something happened, something wrong will happen, who will take care? So in ambulance service, sometimes there are facilities, there will be assigned one doctor, there will be one nursing staff, and one medical emergency technologist. Those are very well trained. So this is the job profile. Again, in future, there will be option for service with that BSc, minimum BSc degree, and they will get the opportunity to do higher studies also. Thank you. Next. Okay, this is excellent. Yeah, next is cardiac perfusion technology. So, cardiac perfusion technology is specially assigned for CTVS department, cardiovascular thoracic surgery department. Basically, what is their job profile? They are assigned or they are trained to run the heart lung machine, to run and take care the heart lung machine. Suppose during any kind of open heart surgery, heart needs to go to the bypass or this thing on pump. There will be, for the surgery, we need to arrest the heart. We need to go for the heart lung machine. If I make it short to make you understood, during the surgery for the open heart surgery, you have to open the heart. You have to cut through the heart. So during that phase, heart is not able to work. So that heart work, if heart will not work, the patient cannot die. So mechanically, we have to make the heart working. There should be some substitute. That is the concept of a heart lung machine. During the procedure, suppose one cardiac surgery, open heart surgery will take 3 hours of time. So that 3 hours heart function will be taken care of by that heart lung machine. This is called that is called the heart lung machine. So that heart lung machine, it's a very complicated machine, and it is very difficult to handle with that machine, and it's very, very important. Because if a small minor error or mistake of that machine can take one life during that surgery. So this machine, to run the machine, to make the operation successful, these cardiac perfusion technologies are taking a very vital role. They are responsible to take care of that machine, to maintain all the parameter of that machine, and run the machine and maintain any acute emergency during the surgery. Along with that, we all know about the COVID situation. We have already gone through. So during the COVID, when we have faced a very big crisis for lung diseases because of this COVID virus, there was a need. You can heard about the ECMO machine. So it was an alternative substitute for the lung function. Those who are failing for the respiratory failure due to this COVID virus, and there was a lung was not working properly, patient, to make that patient survival, we have to put that patient to a ECMO machine. That machine is also
run and take care by these cardiac perfusion technologies. So this is also a very important and promising profession and job. The importance of this profession is very high, very demanding, and the job facilities wherever this city-based department will be in any hospital, there will be requirement of this perfusion technologies. And if I talk about the future prospect, obviously masters are there, and then they can go for further higher studies. Next. So cardiovascular technology. If I talk about cardiovascular technology, this is basically, cardiovascular technologies are working with the cardiologists. So cardiologists are doing angiography, angioplasty, and device closures. It is done in the cath lab. So this procedure should be done with a very high equipped and very latest technologies machines has to be there. It is done by the guidance of those machines. So these cardiovascular technologies are responsible or entitled to run that machine, to maintain that machine, and to assist the cardiologist to perform that procedure by the guidance of those machines. So they are responsible, and that is the job profile of cardiovascular technologies. And if I talk about the future prospect, obviously higher studies options are there, masters followed by PhD. Then for career wise, once they will complete their degree, they will be eligible to get their job in any private corporate hospital. Then where is cath lab available, then any centers, nursing homes where cath lab is available or cardiologists are doing procedures, then government sector as well. Next. Respiratory therapy. Yes, it is also a very important profession in pulmonology department or respiratory department. So like it is all related to lung, any respiratory failure, or it is very common in today's date because of this high pollution, and after especially COVID, the requirement of this respiratory therapist or the value of the respiratory therapist is increased a lot. Because after COVID, during the COVID and after COVID also, there are number of cases for these respiratory diseases are increased. And to rescue from there, we need respiratory therapists who can train a patient, who can assist the patient, who can help the patient to come over from that acute respiratory failure situation. They are guiding, they are helping, they are assisting patients to recover from their acute phase. So again, it is also a teamwork. Physician of pulmonology or respiratory physician, they are advising some procedure. Those who are having acute or chronic asthma, they are having COPD patients, especially should go through with the respiratory therapy. So it is also a promising profession. Again, for this also, they will get a higher studies option. There will be post this thing complete of degree, they can entitle for job also. The demand is very high in India as well as in abroad also. Next. Yeah, echocardiography. Suppose many of us knows about echocardiography to rule out the heart function, how heart is working. Is there any abnormalities? Is there any problem with the heart or related to heart function? First thing we have to do, if you are having any problem with the heart, or if you're feeling not well for the heart related thing, or any known case of heart disease, intermittently we used to go for the echocardiography to see the heart function. So here there is a machine. With that machine, a physician is doing echocardiography or seeing that heart function or assessing or measuring the heart function. So this machine is handled by a echocardiography technician. He is working in a team with a cardiologist or echo physician, and with that team they are working. Again, post BSc they can entitle for further studies, and they can do for job also. Next. Medical laboratory technology. I'm sure everybody knows, if I giving a simple blood sample for any reading like hemogram or anything, I want to assess blood parameter, I want to measure. or any diseases, if you go to the any doctor, they are advising for blood test. So that blood test, who is doing this blood test? These laboratory technologists are doing the test. There are the machines, there are the process where they are they are maintaining that blood samples for the machines, and they are running the machines, they are doing it, they are observing, they are assessing, then they are coming to the report and they are sending back to the patients. So this whole process is done by the medical laboratory technologies along with the medical laboratory doctor. So again, it's a teamwork. The ground level work is done by the medical laboratory technologists. Then the final report or final approval is done by the doctor. So it is also a very promising and very demanding job profile. You can get job everywhere in any hospital and any diagnostic center. Even for small diagnostic center, there will be need of this medical laboratory technologies. There will be demand in government sectors also, and they can go for abroad. And there is also, yes, higher studies options available. They can go for the masters, they can go for the PhD also, or research work. Next. Neuroelectrophysiology. We all know, if any patient is going through any neuro diseases, if they will go to any neurologist or neurosurgery department, generally they are advising for EEG to see the brain function, to monitor the brain activities. So this activity is done by the neuroelectrophysiologist. That machine, that equipment, that assessments is done by the neuroelectrophysiologist. This is very unique and very demanding job profile, and very important like others. Again, for this also, there will be higher studies options are available. There will be option for job. Next. Radiotherapy technology. See, radiotherapy technology, basically, in radiology, there is two profession. One is radio imaging technology. I think it will come after this. Another is radiotherapy. So radiotherapy, suppose it is basically for basically depends on the cancer patients generally to treat and diagnosis for the cancer patient. Like chemotherapy and all other therapies is done by some particular machines with the radiotherapy and radio imaging. This thing. So radiation. So that machines, that control of that machines to fix how much should be there, how to, because over frequency can also damage, can harm the patient. So this is also a very important job profile. Again, it will be a teamwork. One doctor, radiologist will be there. According to the radiologist advice, the execution for diagnostic, for making the proper diagnosis or treating the cancer patients is done by this radiotherapy technologies. So it is also very important and demanding job profile. And day by day cancer patients are increasing, and success rate for the treatment is also very high comparatively previous, because of these high frequency machines are available nowadays. And without suppose without a driver, what is the use of a car? Nothing. So again, without a respiratory therapy technologies, with that machine nobody can help. So the radiotherapist technologies are also very important in today's days, for especially for the cancer patients. Next. If I talk about the job profile for them, again, there is very bright future. They can go for higher studies, and demand of the jobs are also very high for them. Okay, intensive care technology. Intensive care means ICUs, or emergency area, critical areas of patient. Those who are going through critical illness, patient are getting admitted into ICUs or intensive care unit. So intensive care technologies are the specialized trained person who can manage emergency situations of a patient with our emergency critical doctor and nursing staff. So again, it's a teamwork. There can be any emergency this thing situations. There can be, it is see, in intensive, no stable or no, good patients will be in intensive care. I mean, patients who are critically ill or very sick, they are basically admitted into intensive care. So it's a very high, uh, alert areas where there will be all the sick patients. There will be all the emergencies happens every time, each and every time. So for to take care that emergencies, to support to a patient, we need very well trained manpower, and these are the manpower who are supporting to any emergency, to take care, to overcome from the situation, uh, by the support of a doctor and the nursing staff. Again, it is a very important and promising profession. Higher studies also available, masters and this thing research work, and uh, demand of job is also very high. Next. Anesthesia technology. So suppose one patient is going for any procedure or any surgery. So all the surgeries is done under the anesthesia, whether it is general anesthesia, or it's a partial anesthesia or local anesthesia. So any anesthesia doctors are giving anesthesia with the support of an anesthesia technology. All the drug, all the machine, all the equipments is maintained and monitored by this anesthesia technologists, and the anesthesia doctor is doing the procedure. So again, it's a teamwork. The importance of the anesthesia technologies is very high, and career wise is also important and promising. They can get job in any corporate private hospital, diagnostic center, nursing homes, and the government sectors also, and they can do for go for higher studies also as well. Next. Nutrition. Yes, nutrition is in today's medical field. Nutrition is a profile. It is also coming up with a very important role. It is taking a very important role nowadays, because all the, not only in the hospital, nutritions are equally important in daily life. Suppose you want to maintain your dietary habit, or you are diabetic or non-diabetic, whatever it is, you want to lose your weight, so you need to consult with a dietitian. So the nutrition profession is basically helping you, assisting you to maintain your diet, to maintain your any comorbidity or disease which you are going through, chronic disease like diabetes, hypertensive, what you need to take, what you no need to take, what can be harmful for you. So these things, this advice should come from this nutritionist. So again, we are also offering this BSc program. It is also a very, very important job profile. Once you are complete with this job, uh, you can associate with any hospital, you can associate with any nursing home, any centers, even you can do private practice also. You can there is a provision for nutritionists. They can do their own chamber, they can run their own clinic, where a general person can go and take their advice. So this is also a very promising profile. You can have option for the higher studies also, and you can do your research. You can go for private practice and do your chamber also, along with the hospital job. Next. Blood bank technology. See, every hospital, none of the hospital run without a blood bank. Now, what happened in blood bank? Somebody is donating the blood for any other patient, or for any procedure which may need or may not need for that patient. But in blood bank, if we keep blood in normal place, it will get clot. There will be no use. But there is a process where we have to, if we go through with that process of the blood, we can store for a long time of that bad blood, and we can use it in future. So this entire process or entire thing is taken care of by the blood bank technologies. They are the person who take the blood, who process the whole sequence, who store the blood, who knows, who are well trained, and they are knowledgeable and skillful how to take the blood, how to store the blood, so that it can last along, it can get damaged the blood tissues, blood cells, and it can be useful in future. And there are so many blood and blood products which we have to separate from the blood. So there's all skill and knowledge is this thing, we are training them, we are giving them proper training, and we are making them in that eligible so that they can execute the whole sequence or process. So this profession is option is also available in Amrita Faridabad. We are also offering this course. We have our own blood bank where our student will exposed or will get their hands-on training for all the sequence, all the process. And it is also a very demanding job, but very less manpower are available in the market. But demand is very high, requirement is very high. Yes, there is option for higher studies also available. So it is also important job profile. Next. Physiotherapy, you all know what about physiotherapy. I am sure I no need to explain much about physiotherapy. So presently in Faridabad campus, we are not offering, though it is also part of allied health profession. But in future, very recently, we are going to start for the physiotherapy. Again, for physiotherapy, people can well trained and professional can do their private practice. They are eligible for the private practice. They can be associated in hospital, and uh, demand of the physiotherapists is very high because any sports area, any sports team, they are hiring well-trained professional physiotherapists. For their own companies are hiring, and everywhere, every in all the sports there will be physiotherapists in every sports related company, along with all the hospitals, diagnostic center, everywhere there will be physiotherapists. The demand of the physiotherapist and the private chambers also are available for the physiotherapist. So this is also a very high profile profession, promising, and there will be higher studies option, masters, PhD, specialization in other specialty, and they can go for the professional also. Next. Medical radio and imaging technology. So I talk about the medical therapy that is totally focused on the this thing for the cancer patients to diagnose and treat. But this medical radio and imaging technologists are the generalized in the sense they are entitled or assigned to take care of the other machineries thing which is related to radiology, like ECG, I mean not ECG, sorry, for this CT scan, MRI, then X-rays, all this done by this machine, handle of that machine or handling that machine, maintain or run the machines. The medical radiology and imaging technologies are responsible. It is also a very demanding. Options are open for this professional also for higher studies and job also. Next. Okay, so this is about all the professionals and all the area of allied health specialists. So I've explained most probably, I think, I'm sure whoever is attending this session, all are, gone through the session, had understood the important need, job profile, and the future prospects. Other than this, if you have any doubt, any question, please feel free to ask me. Yes,
So,
madam.
sir, there's some questions for you in the chat box. You can have a check, or do you want me to tell you each question?
It will be better if you can tell me, then I can answer.
All right, sure, I can do that. Okay, so the first question from the student is they've got 500 marks in the score for the NEET examination, and what would they do after 12th? Like, what should they continue as their career? What would be best for them if they've got 500 marks in NEET examination?
See, this question is bit, tricky for me. Tricky in the sense, I would like to advise that person. NEET is something different, and this allied health profession is totally different from the NEET. NEET means this is entitled for the MBBS or to become a doctor. This is the first thing you have to do or you have to pursue. So NEET ranking is something different. first you have to decide or set your mind what you want to see yourself in future. If you want to be a doctor, then obviously you have to go through the NEET, you have to commit over there, and you have to try, you have to crack that. But if you, want to see, it's nothing like in medical profession. Obviously, doctor's profile are very important. The role of doctor, the demand of doctor, or the profile of the doctor is very high. I'm not saying it is not important, but again, in medical profession, the doctor is not only one and only profession are available or important. Along with the doctor, again, I'm telling you, I've started with this phase key. It's a end of the day in medical facility, it's a teamwork. So all the professions are equally important and valuable. So if you want to be allied health profession, there are n number of opportunities available, which is equally important, good as a career prospect, which can give you a stable future financially, and your mentally also. You will be mentally satisfied. You will enjoy your job if you love the profession or that specialty. So this is up to you what you want to see. With the NEET, this rank, if you want to go or pursue any allied health course, first you have to choose yourself which area, which specialty you want to go. Then for the allied health, there will be separate entrance exam, or some universities are offering direct admission also. Like we are now presently, we are offering direct admission for few cases. Specialty where seats are vacant. Suppose 2-3 seats are vacant. In few specialty, that seats we are offering direct admission in that way.
All right, sir. The next question is that BSc in critical care technology has a wider scope or not? So, are you there?
Yeah.
Yeah,
Tell
okay.
me.
Yeah, so the next question is that BSc in critical care technology has a wider scope or not?
Yes, I think I have already explained during my presentation. Obviously, it is also very demanding and promising profession, and very, very high voltage profession. Very, very responsible profession, rather, I want to say. And job stabilities will be there, demand will be there, and higher studies option will be also there.
Okay. So another one is, are there any opportunities for international or international experiences, such as exchange programs or collaborative research initiatives in these courses, if
Yes,
students get
it's
admission?
there. Yes, it's there, but it is totally depends on the university, which university you are choosing or you are going for. Every universities are not having that kind of collaboration. So if I talk about Amrita is a globally, it's a branded university, and with a collaboration of n number of universities and the facilities and medical hospitals in all over the globe, internationally also. If you check about Amrita, you can find out there will be many international collaborations along with our Amrita Vishwa Vidyapeetham. So it is totally depend on the university. Yes, if university is having that collaboration, obviously you will be entitled, or you will get the opportunity to expose yourself.
Right. Okay, so one more question. So another one says that is there any sorry?
Sorry to interrupt. Just
Yeah.
I have seen in screen there is a which profession is better, MBBS or allied.
Yeah.
I'm really sorry. Actually, I cannot forget about me. Nobody can give you this answer. See, because it's totally different. You cannot compare MBBS. You cannot compare a doctor and an allied. This total two professional totally different. The responsibility, the job profile, the career prospect, the future prospect, even for the fee structure. If we go for the MBBS, the fee structure, the infrastructure, the studies, subjects. Yes, it is somehow it is equal, somehow it is common, but you cannot say it is same. So it cannot be same. on nobody can make that difference. Ki MBBS is better, allied is not good, or allied is better, MBBS is not good. So this is totally two different profession, and that you have to choose ki where you want to see yourself in future. That is more important.
Right. Okay, so students are very curious to know that like what sort of like if they need any job after B Pharma, so what companies are there and in which company they have a wider scope. So how they can pursue further, if you could
See,
just put some light on that.
yeah, B Pharma is totally different from the allied. It is totally a different profession altogether. See, after doing B Pharma, what will happen? It is specialization in pharmacology and all the medicine. So after doing B Pharma, if I talk about you want to go for further higher studies, you can do your M Pharma masters, you can go for PhD, and you can go for research. The future prospect is very high in that profession because all the pharmaceutical companies, we have a number of medicine companies available in today's days in all over the globe, and all the pharma companies are, I mean, responsible or bound to take pharma professions, because without them they cannot go ahead. They for a single medicine, if they want to launch or they want to I mean publish in the market or they want to do business, they have to get a approval. They have to first do the research work on that, then they have to go for the approval from the government with that study, and then only they can come to the market. So this entire process is done by the pharma professionals. So demand is very high. The once you are done with the pharma, any bachelor degree, if you want to have the job, you can work in any hospital in the pharma department, or you can go for teaching profession also. You can be a faculty of the pharma department or pharmacology. If you want to go for higher studies, you can go for the higher studies. If you want to go for research, you can go for research. If you want to pursue for job, you can do job. So this is altogether a different profession or profile, and it is very, very important in medical field.
Also, there is any similarity or any syllabus relate similar in both of these courses, Allied Sciences and MBBS? Any similarities?
No, no. Actually, pharma, they are, see, for allied or MBBS, if I talk about both, for both, there is the general subjects like anatomy, physiology, biochemistry, biophysics, professionalism, English, some this vocabulary subjects. Then there will be specialization in pharmacology, pathology, then microbiology, then subspecialties will be there. But pharmacology, there will be basic subjects. After that, they will be only focused in pharmacology. So that is altogether a bit different way. Sorry, you are
And
not
also,
audible.
yeah,
Yeah.
so if any student opt for any allied course, will he have to have no option for NEET PG, or is there any way that he can go for that?
Sorry, it's not clear to me. Any option
Any,
for?
like if any student opt for any allied courses, will he
Mhm.
be having any option for NEET PG, or is it like there is no other way that he can do for PG? He can go through NEET PG or any other ways there.
No, as I said, it is depends on the university. Like our university, first we are offering this NEET exam. Okay, there will be not NEET, it is entrance exam. So student have to go through the entrance exam. So some universities is giving the direct admission on the basis of marks from the 12, and they are doing the short of interview process also. So it depends different universities.
Okay. And also, is there any scope of allied sciences in abroad?
Yeah, obviously it's there. During the presentation, I already explained. I told key options are there, very demanding options in all over the country and all over the globe. But the competent manpower, the skillful professionals are not available. So in that way, it is very demanding profession in today's state, and in abroad also it is very demanding.
Okay. And for like Bachelor's of Science, BSc in Neuro Electrophysiology is related to neurology, or they are both in different like in different domains, or they have different scope in future. Is it like that?
Yeah, I think this person joined late. I have already explained during electrophysiology. No, it is depends on the neurology department only. It's a teamwork. Every time I'm using the same term or language, it's a, basically it's a teamwork. So allied health profession are the part of the team. So for neuroelectrophysiology, they have to work in a team with a neurology department. So they will be responsible to do or run the machine for EEG to assess the brain by the EEG machines, and to check the brain function. And on basis of that assessment, a neurologist will put it take it further for the treatment part. So this is how it is, and it is obviously a teamwork.
Right. So I feel, as I can see the responses of the students, I think most of the questions are covered. I got one more. So, is it getting hard for anyone to distinguish between MBBS courses and life science courses? And you can guide them, and like which thing, again, that's a similar question, but students are asking, they're very curious to know that how they should decide in between which courses they should pursue. So if we can provide them with some, little bit of tips that this is how you can differentiate and make your decision better, so that might help for the students, I guess.
See, one example I want to give, though I'm not sure whether how it is going to help a student, whether it will be motivating or it will be in negative way. But as per my experience as a faculty of allied health profession, and in the this thing, as per my experience since many years, what I felt by the counseling of the student or by reading their mind. See, few category, there are category of students, category of people, those who are focused to be a allied health profession since the beginning. Okay, so few category people are there who are very focused. Ki, I want to be this. I want to be in allied health science. I want to be a respiratory technologist. I want to be a physician associate. I want to be a medical radiology technology. But few category of people are there who's ambitious or whose dream is to be a doctor. But I found many people, many students. I should not mention. I don't know whether I'm right or wrong, but still, it is truth that I have seen many students. Uh, uh, they appeared for NEET. They tried for NEET to be a doctor multiple times. First time, second time, third time, fourth time, but they have failed somehow. They are not able to score properly what they want to do, or they want to for getting a job. I mean, getting a seat in government sector, or somehow some people scored a good this thing, but they are not financially that much of strong from the financial background or family support to maintain that financially need to fulfill that demand in private universities. So somehow the students are get demotivated, that they are not getting opportunity to be a doctor. But I can give you n number of example or student. I can show you these student, they turned into allied health profession, and they joined in the allied health profession after completing the course. When they are working in medical field, when they worked with that dignity, that respect, that profile, that seriousness in a that medical fraternity or medical field, in a team with a doctor and high profile doctors, when these doctors are appreciating them, I cannot tell you how satisfied they are or how happy they are in their profession. They are earning monies, they are getting respect, they are, shining in their career. They are going for higher studies, they are going abroad, they are going in research work, and they are getting appreciated. So this is how also one area, one way of seeing yourself. So I'm not saying ki those who are not scored well in NEET, or they are not getting a chance to become a doctor, they are not good, they are not efficient to become a doctor. But again, uh, rather than getting demotivated, you can pursue, you can come over here, and you can fulfill your dream. If I give you example for physician associate, during the presentation I told you, this is also kind of area or profile where you can fulfill your dream. As an what I say, should say, if you're not getting that opportunity due to any reason, suppose you are not scored well, or you have scored well but because of your financial career, because in India, we have till now, it's very sad, but I'm sorry to say that still there are people or families or kids, they want to be doctor, they have potential, they have that what skill, knowledge they have, they are competent, but somehow because of uh, some reserve seat, because of their family problem, because of their financial problem, they are not getting that opportunity. Maybe suppose if they got that opportunity, they can score well, they can do well, but somehow they are coming to this field as an alternative, they are coming to allied health science, or they are going for nursing, and somehow they are fulfilling their dream. So it can be also a way of seeing yourself, or i mean uh, do the thing in a positive way. So yes, I was talking about physician associate. If you go for that, you will be entitled to assess a patient. You can screen a patient. You can also, do the basic assessment. You can take the history. You can have the diagnosis of the patient by yourself. As being a physician associate, you can treat a patient with some extent, but under supervision of a doctor. So you are doing this, more or less the same job or same profile, but in a team. So this is how somehow you can make yourself satisfied, or you will be satisfied in future uh, with an appreciation, with a good pay scale, and with a stable career. So this is how I can explain.
Okay. So yes, of course, I also agree with you. And one more question. As Amrita Faridabad is new, so what all machine facilities you have? What sort of machines do you have, and what is the patient flow? This is a very important questions coming up again and again from students' end. So if you can put some insights on this one.
Yeah, actually, I already explained. Amrita Faridabad is offering a world-class technology with very high equipped machines or infrastructure. If you come, I will request all of you, whoever is attending, and you people also come and visit our campus. See the infrastructure, see the level of the infrastructure, machineries, see the variety, see the entire campus. If you see yourself, I no need to explain anything. You can understand the entire thing by yourself. You can compare the thing. All the equipments, all the infrastructure, all the machineries we are having in an international level or international categories. So that's why we are confidently offering international level healthcare facilities in our campus. And that all that infrastructure is meant for our student to learn, to get exposed, and for the hands-on training as well. So if you come, if you go through our from our university, or if you passed out of our university, I'm sure you no need to look back. Wherever you will go in future, you will be appreciated for sure, in India and in as well as in abroad also. You no need to find suppose you are going to abroad after passing out from here, you will be not surprised, Arey, how, wow, this machine is also there, I have not seen this machine. So it is something like that if you come to Faridabad.
So which one you suggest is better, Kochi or Amrita Kochi or Amrita Faridabad?
both are good, equally good.
Okay, all right.
Mother,
So,
mother cannot say my kids are bad. Kids cannot say my mother is bad. So Kochi is like our mother center, and Faridabad is like our daughter center.
okay, great. So, as you've given so much insight on the machinery and everything, so of course, students might have understood that they can definitely visit the campus and they can see what all things are there, what all facilities you're providing. So, as we're coming to an end, doctor, so anything if you would like to add on to give some advices to the students or any suggestions so that they can make things easier while choosing up their courses or what things they can go for. So any advices if you would like to add on?
First, come to next slide.
Sorry. Okay.
Yeah, Om Amriteshwari Nama. This is our beloved Amma. So, on behalf of Amrita family, I will suggest or wish you a very good luck for your future, for your career. And again, for the last, I will love to request you, don't listen to anybody. Just listen to your mind or your heart. Because, see, as I'm not saying ki, am I audible?
Yes, sir. Absolutely. You're audible.
Yeah. So I was saying ki end of the day, it is your career. Suppose if I give my example, while I was a student, I mean, my parents was thinking that I will be something in my career. Like I will not say these things, I mean, accurately, but they wanted to see me somewhere else. My other relatives are saying ki you can be this, you can be that, someone will say something else. My teacher was saying no, if you go to there you will be shine, you will do better, you will do good. But end of the day it's me, I have to, it's my life. So uh, suppose if you go to listen, if you I mean by forcefully if you join somewhere, maybe may not be, it depends, but there will be chance where after few years or few decade of your life you will realize, oh yeah, I'm doing this job but I am not enjoying this. So it should not happen. Wherever you will go, you should enjoy your career, your profession. If you don't enjoy, you cannot focus, and if you can't focus you cannot shine. This is all are interrelated. So wherever, whatever your profession should be, you should enjoy that job. If you're doing a very small job also with very small profile, you should enjoy that. Then only you can shine into it. If you don't enjoy that job, you cannot focus properly, or you will do it. You can earn money. Money is alternative, something else. So I'm not coming into money part, but you cannot shine in that. But if you enjoy in that profession, you can commit yourself 200%, and you can. I mean, I'm sure. I believe that you can shine, and you can have a very bright future with a happiness, with a mental satisfaction. So this word mental satisfaction is very important. Whatever you will do, you should be mentally satisfied end of your everything. When you are going to bed for sleep, you should think that, you should not think, "Arey yaar, today also was a, I mean, hectic day. I have done this. Suppose I would be in this profession, I should enjoy that. I should do this. I would have done that. I am done this." So that feeling should not come while you are going to bed for sleep. You should go with a relaxed mind, with a peaceful mind, and with a satisfaction that whatever I wanted to be or whatever I have done today, I meant for this. So this feeling should come end of your day. So think in that way. Don't be in hurry. Make your mind, then decide where you want to go. But if you have, once you are decided, once you are into that, try to give your 100%. Then only you can shine.
Right, sir. Thank you so much. And thank you so much, first of all, for taking out time for us and for being here with us in this session. So we feel that we are incredibly fortunate to have you, and this opportunity to learn from you was it was really great experience for all of us. I would really like to thank all of the attendees as well who were actively participating, and they were asking their thoughtful questions as well. So I hope this discussion was fruitful for everyone who were joining over who were there in the session, and this will definitely help out all the students to make a better decision and do good in their future for their endeavors. So uh, we thank you so much, Dr. Jeet, for being here. It was an honor to uh,
Thank you so much. Thank you. Thanks for giving me the opportunity to speak and share my thoughts. Thank you for allowing me. Thank you so
thank you
much.
so much. Thank you. Thank you. It was very insightful and it was very, very good. Thank you so much for being here. So, for all the students who are having still any questions, our portal is open for you. You can go and ask our counselors. They will help you out with any of the queries or questions you have. I hope Dr. Jeet has resolved many of your questions. So, thank you so much for everyone for joining, and have a good day, Dr. Jeet. Thank you so much, and we hope to see you
Same
again
to
very,
you.
very
Same to
soon.
you, madam.
Thank you.
Yeah,
Thank you.
yes. Thank you so much. Oh, bye.
Bye bye. Thank you.